All right. Hi, everybody. Thank you, Matthew, for the introduction, and thank you, everyone, for tuning in. I'm really looking forward to discussing knee pain because it's one of the most common joint pain experienced, and this number is growing. I can empathize with it. I played soccer, had a knee injury from it, and I've had to manage it ever since. Knee pain is also something that is commonly ignored or looked for quick fix options with medication, injections, or braces. I'm just curious, out of everybody tuning in, how long has everyone been living or struggling with their knee pain? Feel free to type into the chat, and I'll give you a few minutes to do that. Getting some really good answers here. See 5 years, 10 years. I mean, that's not unusual. We get people with knee pain in the office all the time that have had it for a long time. People with knee pain do really well with physical therapy, but sometimes they don't know that that's an option, or what simple things they can do to their day-to-day that can help reduce their knee pain. And that's my goal of today, is just to let everybody know what are some simple solutions that can eliminate your knee pain and literally make your next step easier. So I'd like to begin with the anatomy of the leg and the knee, because it's important and it kind of gives you an idea why knee pain is so common. The knee is the middleman of the leg, in that it not only that it's in the middle, but it has to compensate, or will make compensations for any issues up at the hip or down into the foot and ankle. It's a big weight absorber and leg mover. You can see these major mover muscles here in the front of the thigh. You have your hamstrings in the back. You have your calf muscles and some muscles in front of the shin. It's actually two joints. So you have your thigh and your shin bones here where they meet. And then you also have your kneecap resting on those two bones, those two areas. All these bones are covered in cartilage, which help the knee move smoothly if there's no issues with the cartilage. You also have meniscus to the inside and outside that help do that and also provide some cushion. You have these other cushions called bursa. They're not in the picture here, but that helps reduce friction. And then you have your ligaments here on the side and in the middle that help stabilize your joint. So basically, there is a ton of stuff in your knee. And so all this stuff can have issues, but also respond really well to PT treatment and changes that you can make in your daily life. So one of the main questions, or a common question we get in the office, is should I be icing or should I be using heat? And especially if you've had a recent injury with your knee or if there's any swelling, ice is always the best choice, or RICE if you've heard of the acronym, which is rest, ice, elevate, and compress. You want to ice 2 to 3 times a day for about 15 minutes. And if you just do that and only that, you'll get 10 to 15% improvement. Just remember to put a couple layers between you and the ice. That's why a pillowcase can be good. If you're not sure where to put the ice, the back of the knee is a good spot, just because there's lots of vasculature back there. You can use a bag of frozen peas. There's some do-it-yourself ice packs. We have a nice recipe in our knee tip sheet. Or you can just come by the office. We have some really great ice packs and we'd love to share them with you. Just let us know you're coming in. If you're short on time or you don't like the cold, I highly recommend an ice massage. You just put some water in a Dixie cup and put in the freezer. Once it's frozen, just tear away a layer and you can use it like in the picture here, just kind of in circular motions around the knee joint. I wouldn't do it as long as 15 minutes, but if you do 3 to 5, just kind of checking the skin every now and then, that should be sufficient. Next to ice questions, a lot of people with knee pain ask me about, what brace they should use or if they should be taping. And even before asking me, a brace is often recommended by their doctor, friends, or they see one in advertising, or maybe they're just scared if they've had any instability in the knee or if they've almost fallen. A lot of times after some diagnostic imaging, like an x-ray, and the doctor says, oh, you're bone on bone, here, you should probably wear a brace. I believe that there's a time and a place for everything, and bracing and taping both provide stability, but there really should be a temporary or supplemental thing. So that's why you should really talk to a PT about it, especially what brace you should get, because not one brace is appropriate for everybody. And also learning if you're taping appropriately and what you need to be doing in addition to taping, because that's what makes it effective. I love this saying. My coworker, Dr. Andrew, always says it. Motion is lotion. And then I saw rest is rest. And it's so true, because when we're in pain, our thought is, oh, like I shouldn't move, I need to rest. And that's the worst thing you can do for your knee, because movement is so crucial to healing. It lubricates our joints, it increases blood flow, decreases swelling, and improves flexibility. If you're not moving or resting, you're likely to have your knee joint get stiff, and everything just gets tight and you're not moving as well as you could. However, with movement, it's not a no pain, no gain kind of push through the pain. How you move is important, and knowing what adjustments you can make to your movement and your daily activities and exercise are the keys to being able to move without knee pain. So a first step you can do with knee pain is just kind of think about your day and kind of a day with your knees. What's going on? What are you doing? I just wrote a list here. It's not all inclusive of some typical things patients tell me that they're having pain with. Just out of curiosity, if you could type into the chat, what are some things that are giving you pain right now with your knee? Or what are some things you're not doing because of knee pain? I'll just give you a couple minutes to type into the chat. Yeah, I'm seeing a lot of the same things listed here, and some additional things. And I'm happy to talk about those things at the end of the lecture. A lot of people are losing sleep at night because of their knee pain, which is tough because you're dealing with pain and then you have lack of sleep. And so what I recommend for people, if you're a side sleeper, is putting a pillow between your knees. That just puts the leg in a better alignment. If you do sleep on your back, I would not recommend putting a pillow underneath your knees. That just, even though it feels good, when you get up to move in the morning, you're going to be extra stiff, just because of how you're being in a bent position all night. People have a hard time with sitting, especially because a lot of people are working from home now and have to sit at a desk. I actually made a video at the beginning of the pandemic about how to set up your workstation. And I'm going to share that link right now in the chat if you want to watch it later. Just some things you can do simply to kind of make it a little easier on your knees. Just day-to-day family life can be hard on our knees. If you have little kids or grandkids or just even big kids, you're kind of getting up and down from the floor a lot, just kind of taking care of things. And Dr. Miriam made a nice video of just kind of bath time and how to make some adjustments with like putting down a cushion on the floor if you're kind of helping bathe your kids. But I also made a video here that I'll show you just with some feedback in terms of, it's good to know how to get up and down off the floor to kind of decrease your knee pain. Or if, God forbid, you have a fall, what's the best way to kind of get back up? So I'll show that to you now. So another thing people have a hard time with is getting up from a chair, and how you do it is really important. Dr. Michelle made a nice video that I'll also include the link for. But mainly you just want to, make sure you're having your feet hip width distance apart. Make sure you're pushing through the middle of your feet and shifting your weight forward to stand up. Ultimately, a firmer chair is best, like a dining chair, if you can move it to your TV room, if that's where you're doing most of your sitting. But if you just love your recliner or the couch, placing a piece of cardboard or something firm underneath the cushion can be really helpful. It will give you a firmer surface to sit yourself up and take a lot of stress off your knees. This is a big one. Walking and running is a big knee pain point in terms of people having a lot of pain doing these things. If you're walking on a flat or level surface, really try to avoid bending your knees. When our knees bend, it is the most comfortable position because there's the most volume at the joint. However, it's the most unstable position. So if you're walking with bent knees, there's a lot more friction going on, kind of adding to your knee issues. And so in the tip sheet that we sent out, it talks about hitting with the heel when you first put your foot down, making sure your knee's straight by engaging your thighs, just really kind of thinking about the mechanics. And that also goes with stairs. So same thing, like, making sure you're placing your foot the best you can, engaging your hip muscles to help yourself go up the stairs. If you're having a hard time doing 1 foot or 1 foot per step and you prefer to use 2 feet per step, my recommendation is you go up with the good leg, so whatever knee isn't bothering you, and then go down with the bad leg. So your strong leg or your non-painful leg is the one that's bearing most of the weight. Lastly, you want to identify what things am I doing repetitively? Am I doing something over and over again, and that's what's causing my knee pain? Or is there anything new that I'm doing lately? Did I change my running shoes? Or just the shoes I wear? This happens a lot with the change of seasons. Everyone puts on their flip-flops. I know I'm looking really looking forward to that. But again, since the knee is the middleman of the leg, any changes at the foot and ankle are going to affect the knee. And also you want to think about, what are you doing for exercise? Was there a rapid change in intensity or frequency? And is that causing your knee pain? All right, moving on to exercise. Let's get moving. As discussed previously, there's a lot of benefits to movement for your knees and joints, but also it can help you maintain your recommended body weight. And that ultimately puts a lot less stress on your knees. And exercise is just good for your overall health and happiness. The only issue is if you're having pain with exercise, that can be extremely frustrating. And so what you want to think about is, how are you preparing for exercise? Are you warming up? And what are you doing to warm up? And are you stretching? What type of exercises are you doing? Does it include strengthening? And what are your cardiovascular options that you're doing? And also, how frequently are you doing these things? Is it the right frequency? Or are you in order to avoid overuse injuries? So it's really important to make time to warm up and stretch. So warm up and stretching, for that matter, is often skipped due to the lack of time, or it's not as exciting as exercise. So one tip I can give to you is make your warm up part of your workout. So if you have a half an hour to exercise, make 5 to 10 minutes of that half hour the same thing that you're doing, but just at a lower intensity. And with stretching, like, it's research supported in terms of increased flexibility, that you need to hold it, at least the stretch, for 30 seconds, 2 times per day, at least, or 3 sets, 2 times per day, excuse me. And you have to do it at least every 24 hours. You'd want to target muscles such as the hip flexors, hamstrings, and calf muscles. Those are often tight due to overuse or increased sitting. If you are short on time, I highly recommend dynamic stretching if you don't have any balance issues. These are basically movements that you're going to be doing as part of your whatever exercise you're doing. Dr. Miriam also has a really nice video of that, and I'm including the link here. I have had really good experience as a clinician and also personally with the Hypervolt percussion massager, which uses vibration to increase flexibility of your muscles. I just feel it's a great option or alternative to stretching. It's still good to do your stretches and stuff, but if you're short on time or if you're sitting at your desk and you want to stretch really quick or avoid getting tight, this Hypervolt, and this is a picture of it right here, as I highly recommend. If I'm including the link to the website, but we do sell these in the office. If you want to come by and just see how they work, just give us a call in advance and maybe one of us can kind of come over and just kind of show you how it works and do a demo. So with strengthening, you really want to help out that middleman, that knee. And so we're actually going to focus on strengthening the hip. The hip is a great stabilizer for the knee because it holds our pelvis or our hips steady when we're walking and running. These are some pictures of some recommended exercises. But it's really important that you talk to a physical therapist because there's 100 ways you can accomplish the same thing. And these are kind of the muscle groups that you want to hit. But if you're having pain with some of these exercises, we can develop a program that's specific for you. If you're not quite ready to come into an office yet or don't have time, we do offer tele visits. So we can do it over the computer, over Zoom. And that's kind of a perfect way, especially for like kind of a consult or just kind of an exercise program. So moving on to recommended exercise options to address knee pain, I highly recommend stationary bikes. They're a great at-home option. They're social distance friendly, and people are just more consistent if it's easily available to them at home. There's also less body weight on your knees, but you're getting that movement that's so great for healing. Again, if you're having pain with riding a bike, consider how you're positioned on it, or maybe you need to be using an upright bike versus a reclined or vice versa. Maybe the frequency and intensity is too much and you need to kind of mix it up a little bit with cross training or if you're doing any stretches. If you're new to using a bike, I would recommend starting with 5 to 10 minutes and then adding on time every week. And it's just a great cross training option for runners in general. And speaking of running, I'd highly recommend an AlterG treadmill. We have one in the office. It's a great way to continue training, or whether it's running or walking when you're recovering from an injury. Also just to increase your speed. We've had people that come in as clients and just use the AlterG treadmill. If you guys didn't catch it, 60 Minutes had a wonderful story about NFL quarterback Alex Smith. It was really inspiring. He had a severe injury to his leg and almost passed away, actually. But he's made a full recovery and is playing football again. But part of his rehab was using an AlterG, which was pretty amazing to see when I watched the segment. We do offer trial sessions if you're interested to try it out. Or again, like I mentioned, if you'd like to buy a package, I have a video by Dr. Michelle that I can include in the follow-up emails about like kind of what that would be like, coming into the clinic and using the AlterG as a client. And lastly, with exercise, you really have to change up your routine. It's not unusual that we'll self-select, the same thing because we enjoy it. And it comes naturally to us for exercise. Also, maybe certain exercises only available to us or easily accessible to us. But if you change up your routine, doing multiple different types of exercise, you're really going to avoid overuse injuries to the knee. And you're also not going to have plateaus in your progress, whether that's endurance or strength. So you can use a couple of the recommendations I spoke of previously, but you really want to have a different type of exercise at least once a week. And lastly, it's just great to talk to a physical therapist, especially if you have knee pain. We're direct access in New Jersey, so you don't need a prescription to come in. In your first visit, if you haven't been to physical therapy before, you'll find out what's causing your knee pain. It's not Dr. Google or social media that you're learning your information from. You'll learn why it's there. And this is very important because we're treating the cause and not the symptom, like those quick fix options. And then also you'll learn how to specifically fix it, and you'll have these tools to prevent it from coming back. So now I'm going to open up this time for questions and kind of follow up back with the chat things if anyone has any questions there. All right, thank you so much for coming. I look forward to hopefully seeing you guys in the office